So, without further ado, I'd like to introduce Carrie. Carrie Sawtell is a licensed acupuncturist and is board certified in Oriental Medicine, Acupuncture, and Herbology by the National Commission for the Certification of Acupuncture and Oriental Medicine. She received her BA from Wesleyan University in Middletown, Connecticut, which is actually where US Pain is headquartered. After graduation, she made her way to California, where she studied acupressure. I'm going to pronounce this incorrectly, but Tu Na, Chinese massage, and Shiatsu, Japanese massage, at the Acupressure Institute in Berkeley. She received her Master of Science in Traditional Chinese Medicine from the Academy of Chinese Culture and Health Sciences in Oakland, California. Upon graduation, she moved to Shanghai, China, where she lived for over 3.5 years, continuing her studies. She completed the Advanced Acupuncture Training Program at the Shanghai University of Traditional Chinese Medicine. She also interned at 2 of Shanghai's prestigious Chinese medicine hospitals. She founded Many Rivers Community Acupuncture in Connecticut in 2011, and she also volunteers for POCA, the People's Organization of Community Acupuncture. And Carrie, thank you so much for being here today. We're really excited to hear about acupuncture. And just so everyone knows, I actually love acupuncture. So I hope you get to learn a little bit about it and maybe someday try it.
Great.
Thanks, Carrie.
Thank you, Emily. I'm really happy to be here, and I wanted to thank the US Pain Foundation also for having us and showing our clinic. So today we're going to talk about acupuncture for chronic pain. And the reason we wanted to talk especially about chronic pain is because that's usually what brings people into our clinic. Usually if people get a bee sting or they trip and injure their ankle, acupuncture isn't the first thing they think about, although it is something they should think about, but it's not usually their first go-to. Usually people come to us when they've been dealing with pain for months or especially years, and they've tried everything else and nothing has worked, and they're finally ready to maybe get over a fear of needles or try something that they don't know too much about because they're ready to do anything to get rid of their pain. And so that's where we come in, and we love treating chronic pain, and we really love making pain go away. So today we're going to talk about how acupuncture can treat pain. And I'd like to first start off by talking a little bit about pain in the body and what happens when we injure ourselves, and what happens when an acute injury, for example, will turn into chronic pain. So the first thing we need to think about is that our bodies were designed millennia ago, and even though we have access to hospitals and emergency rooms, we did not have that thousands of years ago. So let's say it's a wintry day and you're grocery shopping and you come out of the parking lot and you slip and fall on the ice and you sprain your ankle. Your body immediately goes into emergency mode. But your body was designed millennia ago, and it doesn't know that you can be rushed to the hospital and get anti-inflammatories and get ice put on and an x-ray if necessary. What it thinks is, oh no, something serious has happened. Maybe you were just attacked by a bear. Maybe you just had a serious laceration and you're bleeding out. So I, the body, am going to do everything in my power to stop this injury from risking my life and killing me. So the first thing the body does is it stops blood flow to the area. So whether you were just mauled by a bear or you slip on the ice, if you have an acute ankle injury, for example, your body will restrict blood flow to the ankle. Now, this is a wonderful, very proactive strategy because it does two things. When we restrict blood flow, it causes that area to get weak and stiff. Now, stiffness will protect you because you won't move or wiggle that joint. For example, if it's broken, you don't want to wiggle the bone. If it's bleeding out, you don't want to push the blood any more quickly. And if it's weak, you're going to favor the joint so you don't put pressure on it. And for the same reasons, you won't bleed out as quickly, you won't injure or re-injure a sprain or a broken bone. So these are very good adaptive strategies, and they've worked well to keep humans alive for as long as we've been going on. The problem is that these strategies are aimed at sacrificing the limb in order to save the body. And we have wonderful interventions now, so we don't need to sacrifice a leg in order to live. But the body doesn't know that. So the body restricts the blood flow. It works on the local healing in the area, and the body hopes that over time it will be healed. And a lot of times this is what happens. Even without Western medical intervention, you can sprain your ankle and hobble around for a few weeks and you'll be fine. But what happens if there's something else that goes on during that healing time? What if you slip and fall again and injure your back? Or you get the flu? Or maybe you have a chronic autoimmune disease or other health issue that your body also needs to work on. The body has limited resources that it can work with every day. It's not like we have unlimited energy and nutrition. So the brain constantly is getting input from the sensory neurons in the body, and it's deciding where it wants to marshal its resources. So when you slip and injure your ankle, the body is focusing its energy on that. But over time, when other things come up, the body is going to switch what it's focused on, and it's going to shuffle those things more highly in the deck, let's say. It's going to focus on the flu you just got or the acute back injury you just got when you slipped and fell again. It's going to stop putting its focus on the ankle. The problem is those sensory neurons in the ankle, the pain neurons, are still firing. They're saying, hello, I'm still in pain. I'm a little better, but I'm not, things aren't gone. And they're firing and firing and firing and firing and firing and getting inflamed and getting weaker. And the signal strength of these neurons weakens over time. And this is the biggest problem with chronic pain, is that even though you still have the injury, the neurons are too weak to send the signal all the way to the brain. So you perceive pain, you know there's pain there, but the brain is not paying any attention. In fact, some of the new research is showing that the neurons that denote the actual location of pain are the ones that weaken the quickest. And we have seen this a lot in chronic pain. And with people with chronic pain, you might have noticed that it's sometimes hard to pinpoint where the pain is. You can't say, I'm hurt right here. It hurts here every day. You're like, well, I hurt here, but sometimes it's here and it radiates here. And, sometimes it's this shoulder, but I know this is what's injured. So this is the problem with chronic pain, is the brain doesn't even know where the injury is. The signal is so weak, it's just getting a bad signal. So this is where acupuncture comes in. This is why acupuncture is a little bit different from other treatment modalities. Acupuncture can actually boost the signal strength of those neurons. So an acupuncture point isn't just a point on a map. It's actually a three-dimensional node of physiologic activity. It is a powerful area that is highly vascularized, which means it has a lot of blood vessels, and it has a ton of nerve endings. We actually have new technology where we can see our acupuncture points light up on the body. They are physiological active hotspots. And when we put a needle into these hotspots, we will increase that signal strength of those neurons. So all of a sudden, the neurons are getting their energy to the brain, and the brain says, oh, we have a problem. I guess we need to work on the ankle. And this is why acupuncture stimulates the body's own self-healing mechanisms. Because as soon as the brain realizes that there's a problem, it marshals all of its resources. So it starts the whole anti-inflammatory cascade. It releases endorphins, your natural painkillers. It starts the whole immune response, including the white blood cells, and it starts targeting the area to heal the tissues. The nice thing is that as these tissues start to heal, as the nerves start to heal, the body realizes, oh, this is no longer an acute injury. I don't need to guard this area anymore. I can actually send more blood supply to this area. So you no longer feel stiff. You no longer feel weak. And instead, we have a virtuous cycle where each time we give you an acupuncture treatment, the inflammation goes down, the circulation increases. It's a powerful thing. This is why we talk about acupuncture being cumulative. Each treatment builds on itself. It's not a one and done miracle. Of course, you read about those on the internet, and we love when they happen in clinic, but they are few and far between. Acupuncture is a process. It takes time, but that's okay. Everything happens slowly in the body. Nothing's ever quick. So it takes a little time, but it's worth it. So let's talk a little bit about what to expect if you're interested in starting a course of acupuncture treatment. Let's say you've had chronic pain for months or years, and you go into an acupuncture clinic and you say, okay, I'm here for my first treatment. What next? Here at Many Rivers, we usually recommend twice a week for 6 to 10 treatments. Sometimes we recommend 3 times a week if your pain is severe, incapacitating, 10 out of 10. But in general, for most people, twice a week is ideal. And we say 6 to 10 treatments because in our experience, about 50% of patients will experience effects within right during their first treatment or 24 to 48 hours after. The other 50% will need a few treatments for us to bump up that signal strength enough so that you start to feel better. And the majority of patients will notice a difference in 6 to 10 treatments. Definitely the longer you've had a problem, the more severe the problem. And certainly problems like neuropathy, where there has been some damage to the nerves, will take longer. So it's important to give it a little bit of time. And we like to think about acupuncture in stages. So stage 1 is to bump up the signal strength enough so that you start feeling some effects. Maybe it's just for an hour after the treatment, maybe it's a day or two, but you start to feel a little better. You're a little less stiff, you have a little more range of motion, your pain levels have come down. So that's stage 1. Stage 2 is when you actually have those effects last between treatments and hold. So maybe you come in on a Monday and your pain is an 8 out of 10, and after the treatment it goes down to a 4 out of 10, and then you come in Thursday or Friday and you say, you know what, my pain levels are still about a 4 out of 10, I'm doing pretty good. When we reach that level, then we start spacing your treatments out more and more. And our hope is that we can keep spacing your treatments out until you don't need us anymore. There are certainly certain conditions that have maybe some severe structural issues, like severe disc degeneration or giant bone spurs or other issues. And in those cases, what we hope is that at least the acupuncture will be able to keep your pain levels down enough so that you can have a good quality of life, so that you can do what you want to do all your fun daily activities, live your life. Yes, you're still having some pain, but it's not where it was when you came in, when you couldn't even think about anything but managing your pain. Sometimes people come in once a week for maintenance, sometimes once a month, sometimes seasonally, for example, for seasonal allergies or things like that, and sometimes episodically, like my daughter's getting married, I don't want to be able to dance at her wedding. I'm going on a week-long golf trip to Florida and I want to be able to golf and come back and not be in pain. So it really depends on how long you've had the problem, how well your body responds to acupuncture, and even in the same person, different issues can resolve at different rates. So maybe you come in with migraines and neck pain and back pain, and your neck and back pain goes away pretty quickly, and the migraines still take some time to work on. So every issue is different and every human body is different. We recommend, if you've tried acupuncture for an issue before and you've only tried it maybe once or twice, 3 times, that it's worth trying again. Because again, we often see in that 6, 7, 8, 9, 10th treatment that we finally get that signal strength bumped up. Or if you tried acupuncture before for one issue and now you have a new issue, if it didn't work for the first issue, it doesn't mean it won't work for the second. Each thing in your body is different, and sometimes acupuncture will work for one and it won't work for the other. I wish I had a crystal ball to figure out when one works and it won't for another, but I don't. We don't know until we try. So it's important to go through a nice, good course of treatment and see how it works for you. The great part is that acupuncture works wonderfully in combination with Western medicine and other treatment modalities. There is no reason that you can't include acupuncture with your Western prescription medicines, with physical therapy, chiropractic, massage, exercise. Acupuncture is a wonderful adjunct modality to whatever else you're doing, and it won't interfere with anything else that you're doing. So Many Rivers is part of the community acupuncture movement, and our goal is to make acupuncture affordable and accessible. And we're actually part of a co-op. We're part of the People's Organization of Community Acupuncture, or co-op, and there are hundreds, at least over 150 clinics in the United States, Canada, and Mexico. And we all offer a sliding scale. And the best part about our sliding scale is that there are no income verification required. You can come in, pay whatever you want on the sliding scale, and we're never going to ask about how much money you make or if you have insurance or anything like that. Most of the clinics in the POCA Cooperative, the sliding scale starts at $20 a treatment. There are a few that starts at $15. Some have a fixed rate, I believe no more than 25 or 30, but most of them have gone to this parameter of making sure that you can pay whatever you want so that acupuncture is affordable for you. So you can find a list of clinics at pokacoop.com, and all of the clinics on that list will ascribe to the sliding scale fees. And if you're interested in finding a qualified practitioner of acupuncture, there are 3 states in the United States that don't have any acupuncture regulations, which means there's no acupuncture license in that state. But for the rest, the majority require a master's degree in Chinese medicine, along with a national board certification. And the national board certification is run by the NCCAOM, the National Certification Commission for Acupuncture and Oriental Medicine. And you can go onto their website, and they actually have links by state that will link directly to your state's own acupuncture licensing body. So you can look up practitioners there. And if they are an NCCAOM certified practitioner, they will also be listed on that website. So California is the big exception. They have their own board exam. But besides California, most of the other states do use the NCCAOM exam. So that's a great way to make sure you're finding a licensed, qualified, and board certified acupuncturist.